Assalamu alaikum. We encounter a number of reasons. I will explain a few here. Most commonly seen is the hormonal depression. And I have good experience to see women suffering with PMS symptoms, that is premenstrual syndrome. A few days before the due date of menses, the women would have some crying symptoms or being irritable or there's a whole range of symptoms of depression or anxiety in that PMS. Now, when I treat such patients, my treatment methodology is to help the progesterone level naturally and in a non-toxic way so that the patient can recover from root cause point of view. So this PMS depression, the hormonal depression, would require a natural progesterone treatment to let the patient recover in a proper way. Another depression, I mean, the hormonal cause we often see is the thyroid. If someone has low thyroid, of course, there are many symptoms like being depressed, foggy mind, fatigue, digestive symptoms. Now, the treatment methodology would be to stimulate the thyroid in a natural way to help the patient recover from the depression properly rather than giving any antidepressant or any antipsychotic medication. Second pattern, which I commonly see in my practice, is the digestive depression. Now, here is something interesting. Serotonin, which is a neurotransmitter, that's a chemical which helps for the brain to function. Now, interestingly, that is produced more in the gut. Now, if you don't have a proper gut, you're going to have the problem in production of serotonin. So that means you're going to be depressed. Now, this is a wrong direction to treat the mind. Rather, treat the gut so that this type of depression can go away. So the point I'm emphasizing is that we need to understand the root cause of the problem, be it depression or the other chronic ailments. Then we need to address those specific root causes so that the patient can recover in a holistic and non-toxic way. Third pattern is very common again, stress induced. Oftentimes what happens is the cortisol level goes high in such patients and that causes the depression. Use magnesium, increase the magnesium intake in your diet. That will help you to keep your stress under control. So if I have a patient which has stress induced depression, I would take a very thorough case, and then as a part of the treatment with my natural remedies, I would tend to prescribe magnesium for such a patient, be it in nano supplements or by using such diet. Fourth pattern is seasonal affective disorder. In a particular time of the year, the patient get depressed. And finally, what I want to share with you is the Western diet induced depression. And this is a very commonly seen depression. What happens is that we are using lots of sugar these days, white sugar, and that gives you depression. Now, when I'm treating such a patient with my remedies, with my natural treatment plan, I would include magnesium, chromium, zinc, and omega 3s to help such a patient. Likewise, I want you to emphasize that deficiency of folic acid, vitamin B, vitamin C, vitamin D can also give you depression. So, in order to treat depression, I need to understand your case thoroughly. I need to take your symptoms, your history, everything into account properly. Then I need to solve this puzzle. I need to see what's really causing this depression. And then for that root cause, I need to make a treatment plan like natural remedies, nano supplements, and diet. And the good news is that it's all online. I have been helping patients for a number of years for different ailments. So brothers or sisters are welcome from all around the world. As long as you can have access to my remedies, you can have your consultation. I've got most of my practice in UK and a few other parts of the world. So just go ahead and leave your details. I will get you back, and then we'll have a free 10 minutes assessment session where I'll ask you briefly what's going on so that I can understand your situation properly and I can let you know how can I help you to recover in a non-toxic and holistic way. So see you on the other side. Take care. Jazakallah khair.